So we're excited to have Megan Gomez today. Dr. Gomez is she's a psychologist who works at the Long Beach VA, and she's been doing some great social support in her own way throughout the pandemic, but also before that, she's worked in the VA, runs a support group with our Parkinson's patients that are there. As some of you may know, I'm the director of the Parkinson's Center of Excellence, which is called the PADRIC in the VA. And we have a lot of veterans that we are serving, and many of you that may be veterans that we aren't serving. So we'd love to hear from you. We have ways to connect you with some great resources. We have 6 centers of excellence in the country, and we have some sister sites. Our territory, our VISN, which I sort of am able to serve people through to New Mexico and up the coast to San Luis Obispo, from LA down to San Diego. We have a large territory. We have a number of sister sites. So Long Beach VA is one of them, San Diego. We have folks in Albuquerque, Tucson, Phoenix. So we have even into Las Vegas, a number of movement disorder providers. And so Megan is one such sister site provider, and she works with our folks in Long Beach. So we want to maybe hear from you, Megan, first about your how you got interested in psychology and working with Parkinson's patients, and also about your interest in working at the VA as well.
Yeah, thank you so much for having me. I'm so excited to be with you all today. So my interest in Parkinson's actually began when I was in high school, and my grandfather was diagnosed with Parkinson's. So as his Parkinson's progressed, I kind of stepped in and helped my grandma take care of him. So I ended up moving in with them and really getting to see the impact of Parkinson's, not only for the person with Parkinson's, but for the family. And then when I was doing undergrad at USC, I did a research assistantship at the USC Department of Neurology. And through that, I got really involved in Parkinson's disease research, and I knew I wanted to major in psychology and become a psychologist, but through those experiences, I realized I wanted to work with people who had Parkinson's disease and their families. So that's how it kind of started, and I've been really fortunate to be able to have a good part of what I do at work revolve around people with Parkinson's and their caregivers.
That's awesome. And tell us a little bit about the VA piece then. When did you get connected with the VA piece?
Yeah, so while I was in graduate training, I did some internships at the VA in Long Beach. And then in 2015, was hired as a staff psychologist. In my current role, I work with the home-based primary care program. So this is a program for veterans who have a hard time coming to the VA campus for primary care appointments. And so we have a team, an interdisciplinary team that goes to the veteran's home to provide care in the home. Of course, this was all before COVID. So a lot of our care has switched to phone and video. But it's really nice to be able to get to know the veteran and their families in their home, in their own environment, and to see how their lives are working out. You get to see the nuances of their home setting and what's working and what's not, so that you can be able to provide intervention where needed.
How cool. That's really cool. And we'll be hearing from your husband as well, who it's a family affair, it looks like. Parkinson's
Yes,
psychology as well. So your husband also does research and work with Parkinson's patients and he's still at USC. So we'll be hearing from him a little bit later on, and I think the next month or two. Yeah. So we're excited to have you. But so we'd love to hear a little bit about your work. And I know you have a passion, and it's so lovely to hear these stories, because I never know, sometimes when we invite a guest, like how they got interested. And I think it touches so many more of our patients when they know that you were touched by a family member. It makes it so much more real. Like you've lived in their shoes in many ways. So I think that's fabulous. So yeah, maybe you could tell us a little bit about your presentation today. I know you've prepared some slides and a talk, and then we can kind of open it up to the chat and see kind of where the discussion goes.
Yeah, sounds good. Is it okay if I share my screen?
Yeah, absolutely.
Okay. Tell me when you guys can see this.
Yep, we can see it. And yeah, perfect.
Okay, great. So yeah, I'm excited to talk about this today. In my role as psychologist in the home-based primary care team, I would say about 50% of the work I do is providing direct care to veterans. And a large portion of those veterans have Parkinson's disease. And the other 50% of what I do is working with the family caregivers to make sure that they have the support that they need in order to best care for the veteran. We know if the caregiver fails, that the veteran fails. So we're very much invested in providing resources and teaching skills to the family caregivers. So this is an overview of what I hope to cover today. First, defining what is a care partner's role, and then talking a little bit about the caregiver's adjustment into the caregiver role, their new identity, their new responsibilities, preparing for the future and making tough choices. Oftentimes, I help facilitate some of those conversations about what a person's values are and how they want their life to look like, what type of medical interventions they want or don't want. And then I want to talk about self-care for the family caregiver, changing relational dynamics, and then finishing up with some resources. So we know that when a person is diagnosed with Parkinson's disease, they are typically independent at that time and they're able to continue to care for themselves initially. But as Parkinson's is a progressive disorder, over time, the person may need more assistance or more help from others. So in order to successfully have Parkinson's disease, a person needs to have their team, right? They need to have people that care for them. They need to be connected with services and supports that reflect their values and their preferences, building on their strengths and their abilities, promoting well-being and addressing the needs that evolve as a disease progresses. And we know that this changes over time, right? What may work for us now may need to be revised a year or 2 years from now. So what is a caregiver? A caregiver can be a spouse, an adult child, a sibling, any other family member. It can be a friend, a neighbor. It could be someone paid or not paid. So we can have informal family caregivers. We can have formal caregivers through an agency. And I know a lot of people don't like the term caregiver because it feels kind of one-sided. Maybe you don't feel like you're giving and not receiving. So there's lots of different terms that can be used: care partner, caretaker, carer. And you'll see that I use those terms interchangeably throughout this talk. But in short, caregivers can not only provide physical care, but also emotional support, financial support, care management. There's so many aspects to the family caregiver role. When we think about caregiving, we oftentimes break it into these two categories, right? Those basic activities of daily living, such as eating, bathing, toileting, getting dressed, getting around the home, getting in and out of bed. But there's also the instrumental activities of daily living. Who's doing the grocery shopping? Who's doing the household work? Who's managing the finances, managing the medication? Who's helping coordinate communication, making the phone calls, maybe helping set the patient up for their video conferences. So you can see that there's a lot of aspects to what we need to do in order to function well. So for the care partner's role, oftentimes it's evolving, right? It's a fluid, always changing role. So it may start out that you aren't doing too much for the person with Parkinson's. They may be pretty independent, pretty autonomous. But as we discussed, as the disease progresses, there may be more caregiver responsibilities that need to be assumed. So Parkinson's can change over time, and it can be really tough to balance that family caregiver role. So this figure here, it kind of shows that in the beginning, the caregiver role or slice may be pretty small. And over time, it can grow, which inevitably will change the role of the family dynamic, whether it's a spouse, whether it's an adult child, whether it's a friend, etc. So as a care partner for someone with Parkinson's, it's important to learn how to be an advocate. And in order to do that, there's a lot of information that we have to learn about Parkinson's, right? In addition to being the advocate, oftentimes the caregiver may become the chauffeur, driving the patient to and from medical appointments, to and from physical therapy, to speech therapy. They may be the one to prepare the meals, take care of the home, manage all of the medical appointments. So seeing the movement disorder specialist, all the various therapists. They may serve as counselor themselves. Maybe they're the ones who are giving the patient the pep talks, helping them stay motivated and engaged in treatment. You may feel like a pharmacist managing very complex medical regimens, maybe filling the pill boxes and reminding the patient when it's time to take the medication. As we know, Parkinson's medications can oftentimes change, or the time that we take the medication may change. You may feel like a nurse having to tend to different medical issues. So as you can see, it's a very demanding role. There's a lot of different aspects to it. And oftentimes we find that people with Parkinson's may have one primary caregiver, but there may be other caregivers that take on different tasks. And ideally, those tasks can be delegated amongst different people so that the responsibility or that burden doesn't fall on just one person. So the caregiver identity, while your loved one with Parkinson's, Parkinson's disease, the diagnosis hits us all at once, but oftentimes the identity of becoming the caregiver takes some time to develop, right? It's not like all of a sudden we know exactly how to be a caregiver. It takes some time to figure it out. What does the patient need help with? What do they prefer to do on their own? And it's a constant dialogue of what sorts of things can I help you with? When does it feel overbearing? When do I need to push you? When should I just let you make your own decisions? And so again, it really requires a lot of constant communication. And it's not like you have one discussion and you're done. Each day is different. Some days are good days, some days are bad days. When you have those fluctuations and symptoms, again, that communication is so important to clearly identify what are your role, what's your role as a caregiver, and being able to navigate from caregiver role to family member or spouse. And that's tricky to navigate. So attitude and approach can make a big difference in quality of life. And this goes both ways, right? It's the attitude and the approach of the person with Parkinson's as well as the caregiver. There's so many different factors that play into this, such as a person's personality, how much have they valued their independence, how much have they been, has the family been interdependent on one another, how comfortable are people asking for help? So the person with Parkinson's may have changes in their personality or their cognitive ability. They may have impulse control behaviors or other difficult behaviors, which can really impact caregiver stress. And we know that these different factors, which can be common in Parkinson's, can result in caregiver stress and caregiver burnout if not addressed early on. And with COVID, there's been a slew of changes that have happened. A lot of the resources and support for family caregivers have been taken away. Maybe the patient used to go to adult day health care, and that's no longer available. Maybe they had a paid caregiver that would come into the home. Maybe they don't feel comfortable having the paid caregivers come in now due to COVID. There used to be respite care. So family members may have had a week or two where they could get respite care if they needed to have surgery or if they needed to tend to themselves, their own self-care or other obligations. And now respite care isn't as available. So COVID has made it so that family caregivers aren't getting a lot of the breaks that they need and have become accustomed to. We all know that Parkinson's is a complex condition, and it can often feel like a moving target, right? Once we get one symptom under control, maybe a new symptom may emerge. So it requires so much flexibility on part of both the person with Parkinson's and the caregiver in terms of being able to navigate Parkinson's. So oftentimes people want to know what to expect. What's my prognosis? What are things going to look like for me? And oftentimes there's no one that can give you those straight answers because each person is so different. Each Parkinson's case is so unique that it can be really hard to know what to expect. And we know that people with Parkinson's can have a lot of fluctuations from day to day, from hour to hour. The way they feel in the morning may completely change as the afternoon comes around. So again, if you know Parkinson's, you know that you really just have to take it 1 hour at a time because it can be really unpredictable what's to come. So this is just a little picture showing that as a caregiver, every day is different, right? You may have a list of things you wanted to do that day, but that list may get thrown out and you may just have to deal with what comes up as the day goes on. So care partner education about Parkinson's. As I mentioned, one of the first things that is really important is to learn about Parkinson's and learn how to be an advocate for the person with Parkinson's. So that entails understanding the symptoms. Of course, there's the motor symptoms, but there's also the non-motor symptoms, which as a psychologist, I help people work with that. So that can be the changes in sleep. It can be changes in sexual functioning. It could be fatigue. It could be pain. It could be lack of energy, anxiety, depression, apathy. So many different non-motor symptoms, which can be equally, if not more so distressing than some of those motor symptoms. And we know that the motor symptoms are treated with the Parkinson's medications, but oftentimes we have to address some of those non-motor symptoms with behavioral interventions or other treatments. So learning what are the available treatments and considering the impact that Parkinson's is having on not only the patient's life, but also the family caregiver, providing resources and again, exploring that role of caregiving. Managing care. So as a care partner, your responsibilities may include building relationships with members on the healthcare team. And we all know that oftentimes we're introduced to a ton of new healthcare providers, the movement disorder specialists, the RNs, the speech therapist, the physical therapist, all these different people that we're having to schedule appointments with and keep in our mind. Obtaining adaptive equipment. So at the VA, for example, we have kinesiotherapists that can go into the home and assess for safety. Maybe they recommend having a ramp or grab bars, or maybe they recommend using a hospital bed, or want to have a new walker or a new wheelchair. So that all of the adaptive equipment can be a lot to manage. You may require certain types of clothing. And then also just, again, keeping the patient engaged, making sure they're taking their medication, doing their physical exercise, getting good nutrition. And also you may feel like the events coordinator, right? Making sure that they're staying socially engaged with their family, with their friends, that they're not isolating. So obviously it's definitely a full-time job. Again, consulting with a movement disorder specialist, if you're seeing a general neurologist, the caregiver may want to prepare a list of questions for the doctor before appointments. I mentioned here the APDA healthcare communication graph, which is a way of tracking your Parkinson's symptoms. Maybe you want to provide a video recording of the person with Parkinson's, because we know that those symptoms can fluctuate so much. Maybe when they go see their movement disorder specialist, they're doing well. And so it can be hard to convey on a bad day when I'm off, this is what I look like. And then keeping a list of all the doctor's contact information. It's so important as a caregiver to stay organized. And this may come naturally or easily for someone who's always been very organized throughout their life, or it can require a family caregiver to learn a new set of skills, using a calendar, using the pill box, using all of these external compensatory strategies to help you manage all of these different things that you have to manage. Then you also may have to get to know medical insurance. What are my coverage benefits? At the VA, we don't have to worry so much about that because most of our care is inclusive, but that can be quite the task to learn how your insurance works. You also may want to learn how disability coverage or family leave works. So as I mentioned, time management and organizational skills are so important. And sometimes the work I do with family caregivers is just to help them sort of slow down and to make a list of all the things that they need to do so that we can work together to find a system that works. Oftentimes, the most common concerns from family caregivers is making sure that your loved one is safe, managing your own stress, finding activities to do with your loved one that don't involve caretaking, activities that you enjoy together that help you feel connected, that preserve that relationship that you have, and then taking time for yourself. And I know that last one can oftentimes feel like it brings on a lot of guilt, like you feel guilty for carving out time for yourself, or you don't feel like you have time for yourself. So oftentimes what I work with caregivers is challenging some of those thoughts and creating that time for yourself, scheduling it, making it a priority. Preparing for the future. So we know that Parkinson's can hit different people at different parts of their life, right? For some, they may still be working. For some, they may have young children. For older adults, it may be having discussions about finances or about care placement. So a lot of discussions are about how long can we keep the person with Parkinson's at home. For some people, they say all the way to the end. For others, it's about when X, Y, and Z happens, we may need to consider a higher level of care, like an assisted living facility. So having those types of discussions with families when there may be multiple opinions and not always a consensus on that. Making tough choices. So if a family is reluctant to filling out a post or a DNR, or they haven't made a living will, a lot of what I do is trying to figure out what's the avoidance? Why are we not having these discussions? And how can we help facilitate these conversations that are really important to have? So self-care for the caregiver. I oftentimes use the analogy when you're on an airplane, they always tell you first put on your mask before you help somebody else. And I think it's so relevant for family caregivers. Oftentimes they put their own needs and their own care on the back burner. And we know that they have to take care of themselves before they can take care of someone else. Self-care. So it feels like a marathon, right? Having Parkinson's you're in it for the long haul. So we oftentimes have to make sure that the family caregiver is tending to their own needs, making sure they're going to their medical appointments, making sure they're getting their medication, getting the sleep that they need. Oftentimes our family caregivers are so sleep deprived So working on sleep hygiene, working on creating time for them to rest, making sure they're having time to take their walks, to do their meditation, whatever it is that feels restorative and helps them feel rejuvenated. And of course, that's different from person to person. And oftentimes it's important for family caregivers to just acknowledge how they're feeling. There can be such a slew of emotions that we feel. We may feel sad that our loved one has Parkinson's. We may feel afraid of what's to come. We may feel anxious. Am I equipped to care for this person? Do I have what it takes? Talking to someone who is going to listen and not judge you is really important. Using a journal if you don't feel like you have a person that you can talk to. It's also really important to identify what are the biggest sources of stress, what's not working, what is making you the most frustrated in the caregiving experience, and helping you problem solve. Let's work through this problem. What are some options? What are the pros and cons of continuing with the way things are versus trying something different? Forgiving yourself for not being perfect. None of us are, right? But oftentimes our expectations of ourselves are so high. We expect ourselves to be able to do it all and not need to make time for self-care. So a lot of it is really just adjusting those expectations, not only for ourselves, but also for our loved one that has Parkinson's. And we're constantly having to check in and to see how's the person doing, what can they do for themselves? What do they need help with? And revisiting that day after day. What else? We know that the most successful caregiving seems to be a mix of having a sense of duty and obligation to care for your partner, as well as doing it out of love and affection for the person. So if you feel like you're doing it because you have to do it, then you're probably gonna feel that caregiver stress and feel that burnout, as opposed to doing it because you know your loved one needs help and because you want to be there for them and to help them. We know that caregiving and having Parkinson's can be very stressful. But the goal is to keep you in that caregiver stress category as opposed to the caregiver burnout category. When you feel burnt out, that's when you say, I can't do this anymore. When you kind of throw up your hands and say, I'm tapping out, I don't have anything else to give. We really want to prevent people from getting to that place. And again, that requires us to check in. How are things going? What's working? What's not working? Are we carving out the breaks and delegating tasks to others? Common signs of burnout, that frustration, the fatigue, not enjoying things that you used to do. You can see that there's a whole array of symptoms that someone who feels burnt out may experience. I often give the Zarit, which is a screening for caregiver burnout. So this is just 4 quick questions that you can ask the family caregiver to get a sense of how they're managing that caregiver stress and are they burnt out. Again, creating these plans for family caregivers to help them navigate all the different responsibilities that they have. So stress management is a big one that we focus on, helping them identify what's within their control and what's outside of their control, effective problem-solving strategies, acknowledging their own needs and their own limitations. What are they willing to do as a caregiver? And what kind of crosses their boundaries? And what can we, again, delegate to others? And then building in that quality time for yourself and protecting it. We already talked about some of these healthy behaviors, just like the person with Parkinson's needs to have a healthy lifestyle, so does the caregiver. Maintaining social network. We know that Parkinson's can oftentimes feel isolating, especially during the time of COVID. So it's important to figure out how can we stay connected with other groups or with other friends, so we can work on that. And then seeking additional support when needed, whether that's hiring a family caregiver, whether that's getting a home health aide into the home, whether it's attending support groups. We could just brainstorm. Benefits of support groups, finding that commonality among members, getting education and information, learning how to adjust to the diagnosis as well as your caregiver role, learning practical techniques, feeling understood, reducing stigma, and creating that socialization and fostering friendships. There's also mental health providers. So in home-based primary care, as I mentioned, I get to work with family caregivers. If that's not a program that's available to you, you can always meet with your own mental health provider, someone that can help you with stress management, effective problem solving, helping you manage your own mood. Oftentimes people turn to drinking when they're just so stressed out. So helping you identify some more positive coping strategies. Let's see. I'm mindful of time, so I'm trying to breeze through this, but also just the importance of maintaining a healthy relationship with the person with Parkinson's and their care partner. Again, it may be a spouse, so just working on that marriage. It may be a parent-child relationship. It may be a friend. So whatever the relationship may be, it's so important to maintain that open communication. Again, checking in, what's working, what's not working, acknowledging, what do you miss? What's different about our relationship now? And how can we try to cultivate some semblance of what it used to be? Having a healthy outlet for expressing that wide range of emotions, expressing love and appreciation for each other, having healthy expectations and healthy boundaries, and spending time together apart from the caregiving tasks. Oftentimes we hear wives say, I don't feel like a wife anymore. I feel like a caregiver, or I don't feel like a child anymore, whatever the relationship may be. Obviously, there's a change in dynamics, and I could spend a long time talking about this, but at the end of the day, it's important for the family to work as a team and to be able to identify those common values. Finding meaning in caregiving. So caregiving isn't all bad. It isn't all stressful. From the caregiving experience, you can find such meaning and satisfaction. I know for me, as a caregiver for my grandfather, it was such an enriching opportunity for me. I learned about myself. I felt my connection to my family intensify. I think you learn so many new skills as a caregiver. A lot of people talk about they find their spirituality is strengthened through the process, and you feel such a sense of pride knowing that you're caring for your loved one. I'm just going to end here with some resources. So these are resources specific to family caregivers caring for someone with Parkinson's. And then I also am including just some general caregiving resources here. And that's it. I've included my contact information. You guys are all welcome to reach out if you have any questions. I'm also happy to share these slides with anyone who's interested.
That's awesome. Thank you so much.
Yeah, I know there was a lot to cover.
No, it was perfect. It was really good. I think it was a great overview. And we haven't had one of these, caregiver sessions in a while. I think we did some at the beginning of the pandemic with psychologists. And I think this is just a great refresher on, self-care and that oxygen mask analogy and many of the things that we sort of drizzle into many conversations. But I think taking the time to care about the caregiver is something that is just so needed. So I really commend you it was a very clear and lovely talk. And people have said that it's the best talk that they've heard about this subject. And so, this is a lovely audience. We always get a lot of, positive things. Somebody's asking about the previous slide of general resources for caregivers. We're going to link those, right, Andrea? So we'll link those resources, and we'll link the two slides. So we'll make sure that we give people information. So I think there's been a few questions in the chat, and before maybe too much getting into the chat. One of the things that I think comes up as a physician sort of looking at, or a healthcare provider looking kind of in on a caregiving dyad, and people have asked what a dyad is. It's basically, the person with Parkinson's, and then the sort of person who's, taking care of them, whether it's, their wife or vice versa. If it's a woman with Parkinson's, sometimes it's their husband or their partner. Sometimes it's a child and the person living with Parkinson's. Sometimes you sort of see, like you said, there's this tremendous guilt, and it's almost like they are the only people who can provide the care. And they're like, if anybody else were to be delegated to do this, or involving any other family members, it would be like the worst thing ever, because they've basically let everybody down. And they're like, it's like they signed up for something. It's like a full-time job. And if they ask for help, they're like, calling in somebody that shouldn't be, sort of involved. And it's sometimes, I'm like, well, who else is there in the family? Is there any adult children? Is there any grandchildren? Like, is there, anyone else, that could be kind of called upon? And this is even pre-COVID. And people just feel this tremendous sort of barrier to accessing that type of asking anyone or letting people into the sort of, the dyad care. So how do you kind of surmount that? How, I don't know if it's sort of this need to normalize it and say, these are 5 other people and this is what they're doing. Like, what are the strategies to kind of help? Because I think even starting that conversation, people don't know even how to bring in their adult children. Let's say if it's the wife and the person living with Parkinson's is the husband. How do you even start that conversation? When should it be started? Should it be started early in the diagnosis so that they're prepared? Should it, when to sort of, because, I think sometimes it gets so bad and people get so burnt out that then all of a sudden you're needing to involve these people emergently, and it would have been nice to kind of have these conversations along the way. So yeah, I know that's a very complicated question.
Yeah.
So maybe
No, absolutely. I think a lot of times caregivers will have this knee-jerk reaction when you say, is there anyone else? Nope, it's just me. I'm the only one that can do it. But when you really sort of stop and evaluate those thoughts, sometimes those are just maladaptive thoughts. And so you have to really say, well, tell me, how many children do you have? Where do they live? And kind of get a better assessment of who's there and what's their availability to help. Oftentimes for spouses, they'll say, I don't want to get my child involved. They're working, they have their own family. But a lot of times I will talk to the adult children and they're more than happy to step up and help. They just don't know what exactly they can do. So I think oftentimes it's just giving concrete things that they can do to help. Go to the grocery store, pick up their prescription, whatever it might be. So oftentimes it's just kind of exploring that a little bit. When they say, no, there's no one, let's see if there's any wiggle room with that. And I think the earlier, the better. But oftentimes, like you said, people will wait until there's a crisis or they get sick themselves. So oftentimes we'll say, what happens? Like COVID presented a unique opportunity. We had discussions with the caregivers. We hope you don't get COVID, but in the case you did, who's going to assume your caregiving responsibility? So it really helped facilitate some of these discussions. And even for the family caregiver to say, oh, I never thought about that. I just assumed I'd always be able to do it.
Right. No, I think COVID has had a little bit of a silver lining. I mean, not to, sort of, you use the word silver lining sort of very, very loosely in the sense that, I mean, of course, there's huge loss and so much badness, but, there's some small things that we're seeing that have sort of been able to be discussed, I think, more openly with advanced care planning. And that's amazing that you're doing some of that. And I urge people to sort of look at that more. And we have some videos through this series that have tackled that question a little bit more. But also the concept that, something could happen to any one of us has normalized the conversation, even as healthcare providers, to sort of put in these plans. And I actually wrote a paper with a palliative care colleague that was hoping for the best and preparing for the worst, because I think that's sort of, a good approach for any one of us. And it sort of was a COVID specific kind of chat, but it was really like, what would happen if the caregiver got sick? Do we have, these plans in place and things like that? There's been some great comments about, wishing that there was a Dr. Gomez available everywhere for everyone. And then I think your concept of reframing the caregiving as finding meaning from caregiving has resonated. People are saying that they love that concept, easy to forget that when they're juggling the day-to-day stressors, and that if we reframe our attitude about the caregiving burden stress in a way to see it as a source of positive self-talk, we can relieve some of the burnout in ourselves. And I think that's a great tip. Actually, I've never actually really spent a lot of time thinking about that, but I think, again, it is a tremendous source. And since we're helpful in your own grandparents' lives, I think it's amazing to think about that. And it's something that then brought you meaning and then actually changed your career path, it sounds like. So that's pretty cool. And I think there's also been some comments about, so one is a question about the sort of concept that COVID has now changed the dynamic a lot. And so people are literally just stuck kind of indoors and just, feel helpless about being able to connect with others. And so, it's sort of this, how can you develop coping strategies when you're in lockdown with COVID and a patient 24/7 is one of the things that people have written here. Do you have any thoughts on that tough dilemma?
Yeah, I think it's so important to just be creative. And I've learned so much from different caregivers and seeing what their strategies are. Some people say from 11 p.m. to midnight, that's my hour where I do my knitting or my crocheting, or I play a game on my smartphone, or that's my time. For other people, it's when their partner's napping, or just really being able to find those small pockets of the day where you can kind of just sit back, veg out, watch your favorite show, whatever it might be. But certainly COVID has made it so much more challenging to be able to do the self-care.
Yeah. And one of the comments is that the caregivers are also the IT help desk and tech support person with all the telemedicine needs and everything else and the visits now. So it becomes this extra layer of stress to try to figure out all these things. But again, another place where I think family members can be engaged. And I know my oldest child is 19 and is like the personal IT help desk to his grandparents who live in another country. But it's like they're on the phone for hours sharing screens. And I think, if you have teenage grandchildren or other, I mean, my 12-year-old knows more than I do about most of this stuff. So I think you can engage them. There's a question here about trauma. And I know Drew's going to speak to that because he's, your husband is an expert sort of in as some of these things go with trauma. Maybe I'll leave Drew to speak to some of the early childhood event stuff, but maybe with your knowledge about the VA population, maybe could you drizzle in a little bit about post-traumatic stress disorder and kind of the population that you see and how you think it's affecting some of this?
Yeah, absolutely. I think it's a great question. I think for a lot of us, we assume that the relationship with the person with Parkinson's and the caregiver has been a functional one, right? But in a lot of instances, it hasn't. Sometimes it's an abusive adult who goes on to develop Parkinson's, and their child who they abused is now assuming the caregiving role. Maybe there was domestic violence in the marriage, and now someone's had to be the caregiver. Maybe it's like you said, the PTSD, where they've so welded that identity of being self-sufficient, independent, don't be dependent on others. You can't rely on anyone. So oftentimes it's really about uncovering what are the long-standing family dynamics here, because oftentimes they're not perfect, right? And it can impact the caregiving. Oftentimes the caregiver feels resentful. Maybe this person wasn't the best parent. maybe they weren't the best partner, and now I'm having to make all these sacrifices and care for them. And so just giving them a place to process how the person with Parkinson's has let them down, and focusing on the here and now, even though there can be so much pain from the past, but how can we make this work for us now? So I think there's a lot of trauma that affects families. So it's complicated. It's not like this person was always the perfect person and now I'm the perfect caregiver. It's usually not that clean cut or straightforward.
Yeah, it is so complex, and being a doctor at the VA is every day. It's like something else. So you add in homelessness, or limited resources, or money, or whatever. It just never ending stuff that we have to contend with. But we have some great resources. So people have been asking about the VA specifically. If you're a veteran, I would check in to see if you have benefits, and then you can get connected. You can, call a local VA. You have to get registered basically. And then you can kind of find out where the centers of excellence are, or if there's a consortium site or a sister site that is like where Megan works. They can often, if you go on the PADREC website, that's PADRECC, and Andrea will addend that as well in the list of things that we can put on here. And then, depending on what your resources are, you can get plugged in with the Center of Excellence or a neurologist that knows about this. And then Megan works in the home-based primary care. So that's not available necessarily to all veterans. It's to people who qualify because they have immobility or other complex issues. But, I think there are many great psychologists in the VA. And I think it's one of the things that we do quite well, actually, in these multidisciplinary teams where we're able to connect people. And I think there's a lot of other resources out there as well, in terms of, if you're not a veteran, to sort of look at a psychologist possibly, or a therapist that might be able to help you with this. One thought here is that some people have felt stuck in grieving the loss, and maybe that's the loss of, their loved one as they knew it, or, with the diagnosis, which is just going to get worse. How do I process that? And then, so maybe we can answer that. But then other people have found that participating in caregiver support groups is the only way to feel connection. They feel very isolated and sad and overwhelmed. So it sounds like people are really finding comfort with each other. Somebody else talks about the journaling as being helpful, and the additional concerns with if somebody's having cognitive issues too with all of this. And so I think there's a lot of issues. So maybe you could just speak to the sort of way to grieve the loss as you find it's actually changing before you.
Yeah, absolutely. There's different ways of coping with loss, right? And I think there's some patients and family caregivers who have sort of taken on that sense of responsibility. Like they turn that sadness and that grief into that advocating, whether that's getting involved in support groups or nonprofit organizations, and turning it into, let's bring awareness. Let's reach out so other people don't feel sad and alone like we do. For other families, it's completely different. Like you said, maybe, as we know, a lot of people with Parkinson's do go on to develop dementia. And so it can feel like you don't have your partner anymore. Maybe they feel like a different person, or it's that slow goodbye. So in those instances, I think having the family caregiver support groups is so important. Being able to relate to other people who are going through the same transitions that you're going through, because it's hard. There's no easy fix.
Yeah. And every case is so different. And, every family is so different. I think people have been, sort of excited by the fact, or happy about the fact that you did point out the fact that people may not be living in perfect lives and with functional issues and families and folks going into, this disease. And so it only sometimes compounds things. And then when you have the pandemic on top of it, where people are literally feeling stuck, 24/7, and not getting to see the family that they love to see, their grandkids and other things, it just adds to sort of more negative feelings, and sometimes not the positive feelings that you get from these other social interactions. So I think you have to find creative ways, like you said, and I think just identifying these things as a group. I mean, making sure that you feel like you're not alone, realizing that this is a common thread through many people, and that the feelings that you may have, even of feeling guilty that you're feeling like this, or that you're not able to do everything, and that you want your own time and you want your own space sometimes, and it's all very natural. And I think as a Parkinson's doc, one of the things that we try to do is, kind of think ahead, but there's not really, somebody has asked here about a playbook. Is there a playbook for on the most common daily activities, sort of, this sort of practical daily playbook based on most practice? And I think, we're, even as physicians and as healthcare providers, trying to, learn as we go. And I think, help support people through this pandemic as we're sort of learning from each other and even our patients sometimes. So, I don't know, do you have a playbook that you refer people to, Megan?
I don't. I think it's so individualized. And as we're talking, I keep thinking about, sometimes like a spouse may have been with the person for 60 years. And that looks very different than people who get married later in life. Maybe it's their second or their third marriage, and they've only been together 10 years. And Parkinson's presented itself and they weren't expecting it. It can also be hard when you're the new spouse, but the adult children of the person with Parkinson's have different opinions and want care to be handled different ways. Or there can be conflict amongst the biological siblings. Why am I the one having to care for our parents? Why aren't you helping out? So there's so many different scenarios that
Absolutely.
can play out.
Yeah. And I found sometimes when you see families and you try to take care of them, sometimes on the surface, it seems like everyone else is perfect. And this happens day in and day out. People are like, oh, look at that guy. He's so perfect. And his wife is so perfect. And their kids are so perfect. And then meanwhile, I'm taking care of that family. And I know that there's no perfection there. What you scratch the surface. So I think, we're all human. Everyone's living in, the same type of houses with the same complex dynamics. No, I've never yet to meet a perfect person or family dynamic. And so I think when everyone seems like they're holding it really tightly together, it's, often not the case underneath the surface. So I think communication is also absolutely key. I think we can't help our caregivers if they're silently suffering, and also involving their doctors also is important, because I have sometimes in situations where it works both ways. Sometimes we don't know anything about what's going on with the caregiver, and it's important to tell us, but also there's times when we're treating the caregiver's issues and trying to get, but that also could be helped by involving the caregiver's, team of care providers as well, and getting them into a therapist or whatever support mechanisms, and involving their own healthcare providers is important. But it's all about, I think, communication as well is very helpful. So somebody writes here that the David Spinney Foundation has a helpful playbook for care partners. Go to their website. Somebody else writes, PD is a team sport, and the care partner must be involved in looking for other therapies and should be at all doctor appointments. Because somebody had asked how to discuss new treatments and advocating or asking for things when the patient may not be terribly good at this, and then they feel like they're going around the patient or talking over the patient sometimes to the neurologist, or healthcare team. And I always feel like it's much better to involve the family and in the conversations and getting the history. I find it important to have them at the bedside or at the visit if possible. And now that we're able to Zoom into or whatever VVC into people's homes, we've been able to sometimes engage other family members that may not have normally been able to come in. So, and I think it's interesting because I'll see the family like walking in the back. I'm like, isn't that your son?
Yeah.
Can we have them come over and talk? But like, it's not like something that people have, for some reason, they feel like it's just about them and this is their doctor and they don't want to really include anyone. And I think often when you get the family member involved, they're like, thank God you involved me. I've been waiting for this day to become more involved and engaged. And honestly, as an adult child of parents that are aging, I would much rather be involved and know than be out of the circle and then find out something after it's already been very bad. So, I think that, it definitely, I think making those conversations start to happen, and maybe this video is a starting place where you can show your adult or send it to your adult kids. Somebody has asked how to engage people across the country. Show them, the sort of needs of you and your, the person that you love with Parkinson's. And maybe by seeing this, they can kind of say, start the conversation a little bit and kind of see what might be able to, like, they could make the vaccine phone calls or, whatever, like they could do something.
There's a lot you can do remotely.
Yeah. Maybe speak to that for a second. I'm just going to look at some of these other chats. And we have like 4 minutes left. So maybe talk about what people, adult children or folks can do remotely to help, maybe with
Yeah.
their parents that are living in LA. If you live in New York or somewhere, what could you do?
I oftentimes hear from family caregivers, I just want them to call and check in. I want them to tell me what's going on in their lives and maybe ask as a caregiver how I'm doing. Oftentimes it can feel like the whole family is revolving around the person with Parkinson's. And I think the caregiver can sometimes feel lost in that, like they're not as important as the person with Parkinson's. So I think just calling, checking in, asking what they need help with, asking what's on the calendar coming up, just expressing your interest and your concern and your desire to be involved.
Somebody here writes, I'm the 78-year-old caregiver for a 49-year-old son who has early onset Parkinson's. That's another whole role, I guess.
Yes.
So it's, I think we assume things and, it's never one stop. Somebody writes here, I do my mom's grocery shopping from the West Coast. She lives on the East Coast. She tells me what she needs. Helping from 3 miles away, she orders online and has the groceries delivered. My PWP wants to maintain his anonymity, how to deal with that. I mean, I think, again, everyone's very different. So we can't force people to do exactly what we think. But again, having the conversations, I think, are a good entryway. This hour has literally flown by, and we could have you on just to talk about some of those, each of those slides could be another hour, honestly. So, so we should, continue the conversation, and thank you for the work that you do. And Megan, you're amazing. I mean, our patients in Long Beach and that whole area love you. So I really appreciate it.
Thank you so much for having me.
A last minute or two of goodbye inspiration.
Yes. Yeah, so I just want to tell everybody you're doing a good job. I think so often we don't hear enough. Like I oftentimes will tell family caregivers, look at not only what's coming up to do on your to-do list, look at all the things you've done in this past month or this past year. I think oftentimes we don't stop and reflect on all the things we've checked off our to-do list, and we don't sort of give ourselves that pat on the back for doing a good job and keeping our family member home and tending to them and caring for them. So I think everybody deserves a big round of applause.
Yeah, I agree. I mean, I think I spend a lot of time, looking across and I'm seeing, my beautiful patient there and then the caregiver, and we develop relationships with our caregivers and are often trying to ask you sort of in subtle ways what else you need to be doing to sort of get your own support and trying to cheerlead for you. And so it's around, the patient. And I've had caregivers that want to just come in and see me, as their patients get, older and or whatever, and then can't come in. And it's just sad that, honestly, the healthcare system is not built for ease of care giving. I mean, providing care to the carer, right, as well as the patient. We should have ways that we can kind of do counseling just for caregivers and other things as the neurologist. It doesn't happen. So I think the VA is kind of a little bit ahead of its time in some of these regards, but I think we have a lot of work to do. But thanks so much. I so appreciate your time, Megan. And we look forward to hearing Drew's talk in the next month, and we can continue the dialogue.